First this evening, let's begin by queering up South Florida and Florida. Holy Cross Health and Von Biggs become leaders of LGBTQ plus healthcare for South Florida. As the Broward County HIV Health Services Planning Council Vice Chair, Von Biggs is a staunch advocate who challenges misconceptions and champions the rights of those affected by HIV/AIDS. His role as Community Outreach Coordinator for HIV self-testing at Holy Cross Health aligns perfectly with his mission to smash the stigma surrounding HIV/AIDS through innovative campaigns and social media outreach. With a profound understanding of marginalized communities' challenges, Biggs shapes policies to enhance HIV healthcare access and testing availability. Moreover, he's respected in the community for the work he does to combat stigma and promote mental health awareness, underscoring the importance of holistic healing approaches. His artistic expression enriches his advocacy, fostering empathy and connection within the community. Biggs' principles align seamlessly with Holy Cross's health ethos of reverence and integrity, making him an invaluable asset in fostering safety, equality, and health for all. Holy Cross Health has an interesting and growing focus on the LGBTQ plus community with a major hospital in Fort Lauderdale and other health and clinic services, Wilton Manors, Oakland Park, and across South Florida. Holy Cross is a unique healthcare system, bucking this growing trend to actually provide more inclusion and diversity. In fact, his ongoing efforts at Holy Cross Health, including submitting the Health Equality Index with the Human Rights Campaign, signify his unwavering commitment to transformative change and community engagement. You know, I will start by saying that, Von, you are an incredible friend. I adore you. And, you know, thank you for everything that you do for our community. How long have you been over there at Holy Cross now?
So it's been about 1.5 years with Holy Cross. Prior to that, I was with the, actually Ryan White, the HIV Planning Council. So I served as a peer advocate for them where I helped people who got into the Ryan White system who were living with HIV.
You know, we're countlessly speaking at this table about the healthcare disparities that we deal with in our community. You know, it goes without saying that Black and brown, I can speak for myself, a lot of us don't, we don't trust healthcare providers. You know, we have a history of going to healthcare providers that don't understand our needs, don't understand what we're going through. We can take that to the level of, you know, HIV/AIDS. There's a lot of people in our community that won't get tested, you know, just because they feel that they're not going to get provided the right services. And at Holy Cross, you're trying to break that stigma and, you know, and help everyone in our community.
Well, I think it's important. Testing is important, clearly. We are the highest HIV area in the country. We're #1 in the country.
Well, Black women are #1.
So overall,
we're #1. We're #1, not for anything good.
So I think that's an important factor because it brings the awareness to everybody. We need to we need to normalize the conversation and the fact that we can talk about it at any setting. I have no problem walking into a room and saying, you know, HIV lives with me. I'm a person that lives with HIV. And I'm a very healthy person. I'm going to live a very long life because of my health care. You know, I think of people like Billy Porter who came out and said the very same thing as a Black male. Because of his health care access of living with HIV, he will live a very long life as well because he is going to that doctor every 3 months for testing. And it's important. Even people on PrEP who are doing prevention, they're still going to the doctor every 3 months to get tested. And it's that consistent follow up and follow through, and it's getting access to healthcare in settings where there are not clinics, which is a challenge.
Which is a challenge. What do you say? You know, unfortunately, a lot of my gay boys have been using PrEP as just like, you know, just a control. Oh, I'm not going to get it. I'm fine if I'm on PrEP. What do you say to someone who uses that way?
Well, there's a lot of things that's going on regarding that. You know, when it first came out, there was headline news that you start PrEP, you know, STI rates are going to go up. Now, it's true. STI rates have gone up, not necessarily tied to the fact that it was PrEP that caused it, but people that are on it, they're more sexually free. We are in an age now where especially the LGBTQ plus community are more out in the community. We're more free to be at the bars, you know, whereas it was kind of a hidden door back then. You think about it. You think about when the men would go out, you know, they'd have code, they'd have to wear handkerchiefs or they'd wear keys on a side pocket and to identify so they would know each other where they could do that. Now we have whole communities like Wilton Manors where People just aren't staying.
But it's frustrating that with all of that and with PrEP that we still have this, and we're still #1 in Broward County and Miami-Dade for new cases of infection.
Right.
Yeah.
And it comes back to, do we talk about education? Do we talk about what the schools are teaching kids or not teaching them? Is abstinence the way to go? Absolutely not, because you get so many people that move down to our area that are coming from other places where this is completely foreign to them. And they come into this environment, and if you don't catch them quickly enough to educate them in a way that they find accepting, they end up HIV positive. And so we have these crazy numbers. And then, like you said, if you're in the minority community, if you're black or brown, your chances are even higher. If you're economically suppressed, your chances are even higher. And if you're dealing with stigma, your chances are even higher because the church is saying, you can't do this. You can't be gay. So you have to hide in the closet. And there's still so much to unpack and to try to solve it. And I admire the fact that the hospital is taking a stand in this, but it takes our whole community to actually act.
Completely. And speaking of our whole community, when we think of we're at the table and it's me and Bonnie with a bunch of boys, right? Holy Cross does not just serve men.
Absolutely.
You serve everyone across the board. Right?
Everybody.
Yesterday we were speaking on Monday we were speaking with Carvel from Carvel Bikes, right? A beautiful person in our community, and she says that as a trans person, she's constantly dealing with starting and stopping gender affirming care, because of all the crazy laws that are being passed, etc. What do you tell to someone that's watching our show right now that says, I don't know where to go, I don't know what to do?
Well, a lot of our doctors are actually very involved with transgender care, healthcare specifically. Now, if it's talking about things, there's certain things that we, as a hospital, we don't do. But at the same time, we're there to help all of them with their healthcare needs. HRT therapy, hormone replacement therapy, we're there for that. We can prescribe that. We have doctors who are currently doing that. And in the community, we've heard that, oh, we can't do it here. We have to go out of state for that. And it's not necessarily a true statement.
Yeah.
I think a lot of it can depend too on funding and where their funding comes from, because obviously this is coming down from a state level.
Yeah.
Now, as somebody who works with a lot of trans performers, a lot of them try to get access to therapies in the not safest of ways. Can they turn to you as like a beacon of information and resources?
Absolutely.
That I can sort of recommend you to them.
Absolutely.
To do it safely?
Part of what I do is linkage to care. If you think about it, people want to know how to, I get phone calls all hours of the night. Once you are a peer in the community, it's 24/7. So somebody needs something, I'm going to find, if I don't know the answer, I'll find the answer.
You know somebody who will know the answer.
Exactly.
Yeah. And you've only been with us for a year and a half, but you have made friends with every single organization. And what happens with a lot of organizations, it's like, mine. I won't work with anybody else. And you see Holy Cross at all the events. A lot of the events that I'm hosting, you guys are there, screening, testing, doing what you got to do, getting the information out, It's
getting those silos away. Everybody's in, we put ourselves in our own silos. We have our own letter. And we stay in that letter, but let's knock down those walls and start working together. And we can do that. We really can.
And I love that you're that engaged, because just coming from Holy Cross has a significance related to the church, which is quote unquote not always accepting, well, here we are at Sunshine Cathedral, which is the opposite of that. And your hospital is the opposite of that. But to someone who's not as informed, they just see Holy Cross and they're like, hell no, holy to the, I'm not going in there. They're going to kill me.
Say it just like that.
No, seriously. And so you being out there and being out and proud and reaching is so important, because you have to overcome that as well as everything else.
Well, I think if you think about it, we view it as it's the dignity of the person. It's not who you sleep with. It's not your sexual identity. And that's like even the event that we're having with Hidden Mercy. It's about what the Catholic nuns and the priests, even at different hospitals, how they set all that aside just to deal with the dignity of that human being. And that's ultimately our goal.
Well, here at Hotspots Happening Out, one of our 11 pillars is healthcare, and our community suffers from, not having enough of it, not knowing where to go, being afraid of who to give your information to. The list goes on. And Holy Cross gives you a place where you feel safe, where you get the answers you need. And sometimes we just want to be freaking seen.
Absolutely.
And you do that. So thank you.